Hi students, today we are going to discuss about how to read minor pathways in carbohydrate metabolism, because you are going to have your university examinations on either September first week or second, third last week. In September you are going to have your exam. So for that exam, how to read minor pathways in carbohydrate metabolism. So at the time of revision, first you have to start minor pathways of carbohydrate. The topic is galactosemia. Second topic is lactose intolerance. Why I am giving these two in the same time means both are having same subtitles, right? The first one is introduction about galactosemia. That is accumulation of galactose in the blood and the excretion of galactose in urea. This galactosuria and galactosemia. Here the enzyme defect is galactose 1-phosphate uridyl transferase, right? Third one is metabolism of galactose, that is separate 5-mark question, but galactosemia is separate 5-mark question which is coming under your clinical examination and university practical chart like that. So galactose metabolism is your theory, pure theory question. Galactosemia is coming under your both theory as well as practical question. So first one is introduction of galactosemia. Second one is enzyme defect, galactose 1-phosphate uridyl transferase. Third is clinical manifestations. Usually it affects the babies, so very carefully you have to write the mention the clinical manifestations. Usually three important organs affected by galactosemia is first one is brain. So the babies will go for mental retardation, accumulation of galactose in brain. Second one is accumulation of galactose in liver produces hepatomegaly that leads to increased excretion and synthesis of bilirubin. So the babies are having jaundice. Third one is renal problem. So all the babies are having renal disorder like excretion of amino acidureas. They are having amino aciduria excretion in galactosemias. So like that, three manifestations I am giving. So many manifestations are there. You have to write as much as possible clinical manifestation. These three are the enough for clinical chart or 5-mark question. Next one is how will you diagnose? The last one is how will you manage? Diagnosis is usually urinary examination and blood examination. Some test we are also having, whereas like mucin test. Whereas coming to the treatment, galactose free diet. Only one line for the treatment is galactose free diet. That is about galactosemia. Coming to lactose intolerance, the same one. First one is intolerance of the lactose like food items. Introduction. Second one is enzyme defect is lactase. Lactase, lactase. So what are all the clinical problems? Again, related to GIT, abdomen cramps, vomiting, diarrhea, loss of appetite, like that, clinical manifestations. Investigation the same, lactosuria. All the lactose will get excreted in urine. And finally, disease also, treatment also, lactose free diet, right? So these two diseases from minor pathway of carbohydrate metabolism is first you have to read. Okay.